And we're back here on this Sunday morning. Steve Cashel, Dr. Brian Cole, Sports Medicine Weekly. Time now for our Ask the Doctor segment, always popular, giving our listeners the opportunity to have Dr. Cole address their specific sports injury issues. It's easy to submit a question. You go to our website, sportsmedicineweekly.com. On the homepage, you're going to find a link underneath the photo of Dr. Cole and yours truly. And just click on that link and you can submit your question. Got a couple good ones for you, Dr. Cole, this morning. First one, Dr. Cole, is exercise good for patients with osteoporosis?
Steve, that's a great question because it's osteoporosis, or thinning of bones as we age, is not just a female problem. We know that it happens in men as well. So this answer applies to everyone. And the interesting thing about bone is that it responds to load. So one of the areas that we advise our patients as they age is that they should not only just participate in sort of cardiovascular training, running, elliptical, bike, walking, things of that nature, but weightlifting and load-bearing exercises are incredibly important. We know that load has a direct impact on bone formation in the wrist, in the spine, in the hips, for example, and those are all areas where we see what we call insufficiency fractures or fragility fractures, where the bone gets more fragile as we age. So load-bearing exercise, it should be part of everyone's repertoire when they are committing to some type of exercise program. 45 minutes, 3 times a week. Cardiovascular training is also very important, but I would say people really should not leave out the weight training load aspect because it does help create bone, and that's true for men and women, and becomes equally important every year as we age, because we just lose our bone density year by year, even starting at the age of 35 years old. So super important part of our exercise regimen.
Absolutely. And Dr. Cole, our next question from one of our listeners, again, kind of a bone question, and this listener asking us, Dr. Cole, how is bone healing time different than healing time for, say, tendon and ligament injuries like a torn Achilles tendon or an ACL tear?
Well, that's an interesting question because it does refer to how people recover from injury and then potentially if they have to have surgery. So maybe I'll give the example that we may have used before. We have skeletally mature baseball players who fracture the bone where the Tommy John ligament, the omocollateral ligament, inserts. And when they fracture that bone and we fix it, it's actually healed in 6 to 8 weeks. And you can start loading it pretty early. So I can return an athlete after fixing a fracture around the elbow, right where the omocollateral ligament is, faster than I can if they undergo omocollateral ligament reconstruction where the ligament is repaired. So bone loves to heal in the proper environment. It just has to be opposed, it has to be aligned, and the biology has to be good. And when that happens, it heals very quickly, sometimes within 6 to 8 weeks. The alternative is soft tissue. That heals it takes a much longer period of time, because when we do soft tissue procedures, we actually see a period of weakening at sometimes between 12 and 16 weeks. So as the body tends to sort of incorporate and help these soft tissue grafts mature, like an ACL or the omocollateral ligament, the so-called Tommy John ligament, it actually undergoes a weakening phase as the blood supply replenishes that ligament. And there is a risk of failure if the ligament is overloaded at some point. So we're really respectful of the biology of healing. So as surgeons, we have to know a whole lot about biology. It's not just about fixing things, but we have to understand the time course of healing. And bone in the proper environment heals pretty quickly. Ligaments, they heal slowly, mainly because of the blood supply issues.
Is there any treatment for additional healing of a bone? I mean, when you got to get a player back in the game, does a bone just need to heal on itself, or are there additional procedures that can be applied?
Of course, and that's another great question, because bone, it has to have optimal biology. So the first thing is just basic, there's basic paradigm or things that we have to follow where you want to immobilize fractures when they are seeing forces so that it can be allowed to heal. So basic things like splinting and proper immobilization and bracing can make a difference for certain fractures. But we do some things to trick the body, like bone stimulators. Now, bone stimulators are a device that actually can stimulate the bone cells to form more bone, sort of tricking the body to jumpstart or provide an uptick in the healing environment. So bone stimulators are electronic currents that we can put locally over a healing environment where bone is involved. It can make a big difference in terms of speeding up the healing. The problem is that insurance doesn't really, for better or worse, doesn't value speed of healing. They do value when healing doesn't occur at all, so-called non-union, and they may cover these bone stimulators, but they may not cover them if you're just trying to sort of increase the local environment. When it comes to a professional athlete, we obviously get a little more leeway because the financial aspect is a little bit different than when you and I are trying to get things covered by third-party insurance, for example.
Interesting stuff. Okay, Doc, we're out of time. Appreciate it, and my best to your family. And we will talk with you again next Sunday for a new edition of Sports Medicine Weekly.
Have a great week, Steve.
Thank you. A reminder, everyone, that podcast segments are always available to hear on the Sports Medicine Weekly blog, also through Apple, Google, Spotify, Pandora, YouTube, iHeartRadio, and many other podcast channels. Net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Many thanks to our producer, Shane Reardon, also to David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel. We say so long, and thank you for listening to Sports Medicine Weekly. We'll be back again next Sunday morning, 7 a.m. Central, with a brand new edition of our show, only on
670 The Score.